I have a story today about two totally separate patients I had the opportunity to spend time with this week. I'm Dr. Scheurer from Tranquil Dental, which is of interest in today's story. So my first patient actually happened, I saw earlier this week. And while I was working, she asked me, how did I come up with the name Tranquil Dental? It kind of threw me off. I wasn't really thinking about it at the time. And so I started talking to her and telling her the story. I had been practicing for probably somewhere in the neighborhood of 15, 16 years at that point when we decided to change the name of the office. And so I had to try and pick a name. And what I did was I actually took the time to look and reflect on all the things that patients had said about me and my office through the years. And what I found is that oftentimes I get fabulous compliments, such as that I'm thorough, that I'm precise, that I'm detailed, but also I get a lot of compliments with regards to how gentle I am and how calming I am. And so I told her that at the time we actually, my staff sat and we brainstormed and we wrote out all the words, the descriptive words we felt like patients reflected or noticed about our office, because I wanted to have a name that people would be able to get a sense of what the office and the experience was like. And so we came up with Tranquil. And I think it fits really well because it's a calm environment. I have a gentle touch. It is not an office where you have a lot of yelling or screaming or people hollering down the hall. We're happy, but kind of calm-natured. So the other part of the story, the second patient, which is completely unrelated to the first, was also this week. And it was an individual who came in for the first time in 10 years, over 10 years. And he was so anxious. His heart was pounding. He was very jittery. He was so nervous to be at the dentist office. And there's actually a survey that indicates that there's 20% of individuals who actually stay away. They have so much anxiety. There's a term, dentophobia, that they stay away from the dental office unless there's some severe issue. And so if patients are that anxious and that nervous that they don't want to come to the dental office, then I want to make sure that I can do all that I can to make it a positive experience for them. And so it was a positive experience for him. And by the end of the appointment, he was so happy to be there, be here with us. But it was of interest how the two completely unrelated patients actually, in my eyes, came together in that she asked and inquired how I came up with the name, why I chose the name. And he was able to experience that for himself. So she actually asked me also something about the music, she noted. And the music in our office is very much calming. It's very spa-like. When I go and have a massage, I actually have hear that same music, and it just relaxes me. But I said to her, I listen to all different genres of music, and I love all the different decades. And so you may very well catch me sometime in my car listening to rock music. But rock music raises your heart rate, and so it's great for the gym. But if you're already anxious, it's not going to be very helpful. So I thought that was an interesting story to share with you. Certainly, we don't want patients staying away from the office because that only creates larger problems. And it's kind of a vicious cycle. So we don't want that to happen. So make sure that you're getting in to see the dentist. And if there's ever any way that we can help you, we are here with a gentle touch and a calming reassurance at Tranquil Dental.